I was on a family reunion with my extended family up in Idaho.
I was in the middle of my bridal shower.
My husband saw something on Facebook that there was a ranch fire.
I looked out the window and just saw smoke. When I first heard that Lakeport was under advisory evacuation, I was actually in Sacramento at Sutter University.
We drove back to the cabin, hopped in the car, and headed for the nearest airport.
We just packed up the cake and the quiche and all the orange juice, and we knew that Hospital Incident Command would be opening. It kind of moved everything into the hospital conference room so that we could get to work.
I was just texting staff, sending messages to staff, making sure everybody was safe.
We had a huge smoke cloud just billow over the hospital and kind of envelop us. And so we made a call at that point that it wasn't safe to keep the patients here any longer.
Sutter Care at Home Lakeside was affected by the wildfires. We had to evacuate patients and staff.
The team that I was working with when we were evacuating was incredible. It felt like a well-oiled machine. People just stepped right up into their roles.
Experiencing the fires last year at Santa Rosa made me learn that when people really need to get something done in the healthcare system, it happens extremely well.
And even though people were worried about their own homes and their own families, they were still putting our patients first, which was really amazing to watch.
We had 67 Sutter Care at Home patients evacuated. We started with phone calls when evacuations needed to be, being put into place. And from there we did daily check-in calls.
Teams from other places throughout Sutter Health reached in to help pick up some of those patients and offer video visits and things like that. Just the incredible lengths that people went to take care of the patients that we couldn't serve directly.
It is really something else to watch your senior leaders in scrubs spending the night in the hospital, the support staff that maintenance and security and biomed and all the people who kept the hospital running while we were closed.
It was so much work to get everything back. We had to order all the supplies, we had to clean everything.
The greatest part of it all is just we've had people from other facilities, Sutter Auburn, Sutter Amador, CPMC, Sutter Eden, Sutter Santa Rosa mainly, come to help us, and it's just the outpouring of assistance from people has really been amazing to see.
I had so many people say Sutter for life. That's what they kept writing to me. This is amazing, Sutter for life. They couldn't believe how well they were cared for.
Me and my husband were both out of work, and we were living in a tent with our kids, and so they, without any questions, our manager reached out, said this is the financial, like they're granting you this much money and this many hours. You don't have to use your PTO. Don't worry about your paychecks. That will be taken care of, and within 48 hours we had money in our account to help us with any type of, food and supplies.
Those are the things that happen in a larger organization, and that's teamwork. That's pulling it together for the benefit of the patient.
It's pretty phenomenal how well we can actually come together and take care of people as a healthcare community.
Disasters like this, while incredibly difficult and incredibly stressful, have really shown to me that they bring out something amazing in people.